Doc.
Hello.
Kindly introduce yourself.
Okay, thank you so much. My name is Dr. Asaph Kinyanjui, serving at Operation Smile Kenya as a country manager. So my basic role is just to coordinate program activities, engage stakeholders, including with the Ministry of Health, to ensure we have policies. Yeah, and also a bit of creating awareness and resource mobilization.
Okay.
Yeah.
Please tell us a bit more about Operation Smile and what your mission is.
Okay. So Operation Smile is a global non-profit organization. We have a headquarters in US, and we have different countries and different continents running the programs. So the goal of Operation Smile currently is just to scale up access to safe surgeries. And what we are doing is working closely with the government hospitals and stakeholders to see how best we could be able to address the gap. And why we're in this space is because we know the statistics. We have about 5 billion individuals globally in need of surgery who have limited access. So we are looking at how do we stimulate that by one, capacity building of the healthcare professionals. Number two is supporting the needy patients so that they can be able to get access to care. And number three is engaging government so that they can be able to allocate adequate resources.
And for how long has this organization been existent, both at a global level and even in Kenya?
So globally, Operation Smile is about 41 or so years.
Oh, wow.
Kenya, Operation Smile has been actually in existence for about 36 years. So initially what used to happen is that you used to have volunteers coming from abroad, come and provide surgeries and get out of the country. But that model we have realized is not sustainable. So now the current model we are doing is mostly empowering the local communities or the local healthcare professionals to provide care. So we are looking at, all our sort of our motto is locally driven, internationally supported. So get the international support, but empower the locals so that they can be able to give care to their own. Yeah.
And by empowering locals, does that mean training surgeons, or are there other cadres of healthcare professionals who are also capacity built?
So we look at the surgical workforce, and when you look at the surgical workforce, you have the surgeon, you have the anesthetist or the anesthesiologist who is going to provide anesthesia care. There's a pediatrician who also have to look at these patients, and especially the children, to ensure that even before they go for surgery, they are fit for surgery. We have nutritionists, because most of the patients with cleft lip and palate have significant malnutrition issues that need to be sorted even before they get to surgery. There's a lot of stigma that's associated with cleft lip and palate, so we work closely with the psychosocial providers so that you can be able to provide psychosocial support to the parents and even to the patient. And finally, also work closely with the biomeds, because again, the biomeds also play a key role in ensuring that the equipment being used to provide surgeries are safe. And finally, which is also a core component, is the nurses, because you can't provide surgery without the nurses. So we have the nurses who work in intra or in theater, we have the nurses who work in PACU, and we have also nurses who work in the wards. So when you look at the capacity building, we look at the capacity building of those individuals involved. Beyond that, also we look at the capacity building of the community health volunteers or community health promoters in Kenya, because one of the things we know is that these patients are at the community level. So we need to empower the community health promoters so that they can be able to identify the patients, they can be able to provide basic support, and they can also be able to help in terms of referral mechanism.
Okay. There are very many medical conditions or surgical conditions.
Yes.
Why did Operation Smile just narrow in on the cleft lip and palate?
Yes. So again, it's mostly driven by the statistics. So you realize in Kenya we have about 2,000 patients born annually with cleft lip and palate. If you look at how our healthcare system is designed, especially from a surgery perspective, it's one of the conditions which is neglected. So we realize then there is a big gap in terms of access to care. The other reason why we also chose cleft lip and palate as an introductory part of access to surgery is because of the impact of those conditions on the child. So most of these children, when they are born with this condition, they are not able to thrive because even feeding is affected. There's a lot of trauma and stigmatization at the community level. So, and you find sometimes even these individuals are bullied even when they grow to adulthood. And we realize that there is no need for us subjecting these individuals to that trauma. And that's a gap we are trying to fill. Yeah.
And how has the impact been in the country so far? For the years, you said we've been here for
about 36.
For 36 years
Yes.
in Kenya.
Yes.
How has the impact been?
So we have managed to have a cohort of volunteers who are Kenyans volunteering their time and resources to be able to support these children. So during that period, we have been able to have a very significant pool that we're able to plan a surgical program for 5 days without even having to bring somebody outside the country as an expertise. So that's one of the things we have been able to do. Number two, we have also managed to provide a lot of training and mentorship so that at least we can have younger generations coming into the space and be able also to provide the surgeries to the patients. The other impacts we have also had is now also initiating the discussions with the Ministry of Health, because one of the things as a country is that we don't have a national surgical strategic plan, which could be able to guide even the government in terms of resources, in terms of awareness. So we are working with the government even to be able to work and have a strategic plan. So those are some of the things we have been able to achieve over the years. And the more important is that we have been able to serve over 10,000 patients with cleft lip and palate, and hence improving their quality of life.
How are you able to identify the people who are really in need and those who can be able to benefit from your programs?
Yes, so mostly we rely on the community health strategies. So if you look at the healthcare strategies that currently is developed, so the county governments usually have a community health strategic arm. So whenever you move to a county, that's the department you usually work with, so that they can help us in terms of empowering the community health promoters, creating awareness. And once those patients have been identified, then we have a patient coordinator who is able to walk the journey with the patient so that they can come to the hospital, get reviewed, and then be able to be guided in terms of their management. So mostly is working with the communities because that's where the patient belongs. And even after surgery, this patient will still have to go back to the community. So again, preparing the ground so that the community is able to accept this patient and support them through the journey.
Is there a way the community can reach out to you, or they just wait for the county and the strategies to reach out to them?
Okay, so allow me to respond to that question and also maybe giving a bit of a background on our model. So one of the models we are trying to do is also have regular cleft surgical services integrated in healthcare services, so that patients don't have to wait for a surgical camp like what we are having this week for them to come for or receive surgeries. So we're in partnership with some hospitals in the country, and we're also looking at scaling up that partnership so that every time the child is born, is able to be picked, even let's say even from a maternity facility, and able to get in the proper referral so that they can be able to continue that services. So people out there, one of the things I would encourage them is also to look at for us in our social medias. In our social media, we have an active Facebook page. They can be able to reach out to us, and we'll be able to give them the necessary support and even give them the contacts they can be able to reach out to us. Number two, what I would also want to encourage is medics. Because as I said, it's a volunteer-based organization. So again, I would like to encourage the medical professionals to reach out to us who are willing to give up their time and become our volunteers so that we can be able to scale up these services more to patients in need. I think the last one is mostly also to urge the government, and especially the county governments, also to help even in terms of integration of cleft services at the county level.
Then this time you've partnered with KU Teaching and Referral Hospitals. Why KU Teaching and Referral Hospital?
Yes. So we see Kenyatta University Teaching, Research and Referral Hospital is a very strategic partner for us. One is because of the quality of services the hospital offers. Number two is a teaching and research hospital. And one of the things we look at, especially as we scale down access to surgical services, we need a hospital that is able to train and mentor. So we are looking at the partnership with Kenyatta KUTRH in terms of that if we move to the county and identify a surgical team that needs to be trained, we know there is a hub. Yes, they can come and get trained, they get mentorship, and they can go back to their county and be able to provide care. And finally, we hope even we'll be able to do also research in future with the hospital so that we can be able to identify what are the causes of some of these illnesses, how do we alleviate them, and also even in terms of our outcome in terms of care, how is the quality of our services, because we aim to provide quality services, and the only thing that can help us is as we continue doing research and evaluating our outcomes.
Okay. Yeah. So, Doc, before I let you go,
yes,
is there any specific story that stands out for you for the time you've been with Operation Smile?
Yes, so I've been with Operation Smile for about 2 years. I remember there's a time we had a surgical program in one of the hospitals, and the mother was very anxious bringing her child for surgery. And one of the reasons we realized is that because when she gave birth to this child, the husband actually said, in our community, I've never seen such a child. So this must be coming from your genes, not from my end. And that ended up in the separation of that relationship or that marriages. So and the mother, because they also was having a lot of stigma at the home, at the community level. So when she came, she was quite anxious. She was wondering whether she will get surgery or not. Luckily, the child qualified for surgery. So once the child came out of operating room, the mother couldn't believe it's the same child she came with the hospital, because the child was transformed. The child has now looked normal. And one of the statements she said is, now I'm able even to go back home and attend social functions and going to church, which I was avoiding because I was thinking, how will the people look at me and my child when I go to church? So improving that quality of life that the mother feels is now be able to be accepted as a community was a highlight for me.
Wow.
Yes.
Did the man come back home after the child was?
Yeah. So finally, actually, one of the things is also that because we work closely with a psychosocial provider who was also able to reach to the man, and there's a lot of conversations and reconciliations going on and healing. So hopefully by now, most likely they have gone back together.
Wow.
Yes.
So what you're doing is not just healing physically, but you're even healing socially
and family.
And family-wise.
Yes.
From your experience, what are some of these myths that you've had as you go to the communities and interact with different people?
Yes. I think in African setup, we still believe in some of the back cultural practices. So there are a lot of patients who believe it's either as a result of witchcraft that they have in this. So sometimes we find even patients accusing or parents accusing their neighbors and say, most likely, I think it's my neighbor who has done this. Some others also sometimes they think it's because they wore tight clothing when they were pregnant that maybe could have caused the injuries. Some also have blamed the midwives, saying maybe during the delivery, and especially the normal vaginal delivery, that probably the child was injured and the midwife is not telling the story. So there are those myths cuts across. So one of the things is we're also trying is just to try and create awareness so that we can be able to demystify those myths. Yes.
And finally, Doc, a parent out there who has a child with cleft lip and maybe they're hiding them, what message can you tell them?
They need to appreciate that this is a child who is normal as any other child. They only have a defect that is correctable, and that once that defect is corrected, they'll be able to live a normal life. So don't hide your child, because if one gets to the teenagehood and even adulthood, they're going to have a lot of stigma, and even it becomes hard to correct those deformities. So bring them out as early as possible. Reach out to Operation Smile, or reach out even to Kenyatta University Teaching Referral Hospital, and this child will be able to get the required support so that they can live normal life as possible. Yeah.
Wow, thank you so much, Dr. Asaph.
Thank you, Dr. Caroline.
We really appreciate your time and the good work you're doing at Operation Smile. Keep up the good work. I've interacted with a few of the beneficiaries, and I can attest to the fact that people are happy, lives are being restored, smiles are being restored. So you're truly living to your mission, and keep up the good work.
Thank you so much for the opportunity.